Staying in healthcare, patients who rely on life-saving treatment at rural hospitals won't suddenly lose access to care on short notice under a new Minnesota bill. Representative Andy Smith is introducing the legislation that would require hospitals to let patients know well in advance of a facility's closure. KIMT News 3's Brandon Cote is joining us live in front of Mayo Clinic in Rochester. That's where the healthcare system closed a labor and delivery unit in New Prague last week. Brandon, how might future hospital shutdowns look different to this most recent one?
Well, just under the current law right now, hospitals are only required to give a 120-day notice of a closure completely or moving to a different location and discontinuing maternity services. But under this new bill, that 120 number would more than double all the way to 300 days. Now, the healthcare systems would also be required to host a public hearing 30 days after making a closure announcement and within 10 miles of that facility's campus. The bill also requires more transparency. Hospitals would need to share the number of patients impacted and the amount of long-term care beds lost. I spoke with rural policy expert Marnie Werner, who says Albert Lea has firsthand experience with the issue following the recent closure of Mercy One Hospital and Mayo Clinic's maternity ward shutting down 5 years ago.
They will oftentimes shut down with almost no warning, and so the residents are then left trying to figure out where are they going to go, because the next closest healthcare facility is maybe 20, 30, 40 miles away.
Werner also tells me that new hospitals that want to open up need to be reviewed by the state, but there's no current Minnesota law that requires for a hospital to close down to get a review and approval from state officials. Live in Rochester, Brandon Cote, KIMT News 3.
Thank you, Brandon. If healthcare systems fail to follow the potential new rules, the state would be able to impose a $20,000 fine.